And this is Unlocking Secrets for Women, the voice that empowers communities, right here on 1410 AM CFUN. We educate and we assist women and families with issues that they could face every day. Our topic today is a very interesting topic. It's understanding healthcare and its changes, what is good and what is new in healthcare, and also for women as well. Our guest in studio is the Honorable Colin Hanson, Minister of Health Services. Colin Hanson was appointed Minister of Health Services on June 5, 2001. Mr. Hanson previously served as health critic for the official opposition, as well as the critic for employment and investment and for labor. He sat on the select standing committees on Crown corporations and on economic development, science, labor, training, and technology. He also sat on the official opposition caucus committees on health and economy. He was first elected in 1996 to represent the electoral district of Vancouver, and how do you say that? Quilchena. And re-elected in 2001. Welcome to Unlocking Secrets for Women, Mr. Hanson.
Thanks very much, Candace.
It's a pleasure having you here. And given the day that it is today, I really respect and appreciate your time today here. Thanks so much for coming in. I just want to start off by saying that anyone in the position of healthcare minister across this country has a very challenging and difficult job, and I can honestly say that I certainly wouldn't want to be in your position, particularly today. It's a tough place to be, and I respect you for taking it on, and you certainly have the largest budget in the province, as healthcare takes up 43% of the entire provincial budget.
Yeah.
That's massive.
And it's actually interesting when I talk to my other counterparts in other provinces across Canada, regardless of what the political affiliation is of the government of the day, we all have the same common challenge. And it's interesting when we get together as health ministers, we all can share a lot of, we can commiserate together with the challenges that are before us. But the budget is huge. It's in BC today. It's $10.7 billion. Wow. And when I was first sworn in as health minister 2.5 years ago, it was 9.3. Wow. So it's been growing at a significant rate, growing 3 times faster than our economy has been growing, and that's where the whole question about sustainability comes in. Mm-hmm. But I think too often we try to measure healthcare based on how much money we spend, mm-hmm. and in reality we've got to measure it on terms of how we actually meet the needs of individuals, how many procedures, how many surgeries we can get done, how to get the best value for that money is as important as how much money is in the budget too.
And that's just a huge challenge. I know I sort of have a little story. I look at changes in healthcare as being sort of like that Port Mann Bridge nightmare. I have to cross that Port Mann Bridge, and I cross that bridge, and I look at that bridge and go, was somebody not paying attention to the future? Did we not see this coming? It's as if we didn't believe that Vancouver would ever be this beautiful city that would have grown so much like it is. And now we've got this massive traffic problem, and we know we have to deal with that bridge issue. Everybody's moaning and complaining and grumbling and unhappy, and it makes everybody late for work, and it's a very frustrating experience. And I sort of look at healthcare like that in Canada. I mean, it's, with all due respect to you, it's naive for anyone to believe that this problem happened in the last year or two. This has been ongoing over a long period of time, that it has developed into this problem, and now we're sort of hit where things have to change. And I guess that's the challenge that's in front of everybody is, do we need to change? Well, we all agree that we do need to change because there's problems. How do we change? How fast do we make those changes? What are the reactions to those changes? And it becomes very, very difficult for people. So I'm going to I talk a little bit just about where I come from, because I'm in a very unique position. I am an HEU member, which is just so ironic to have you sitting here today. I am a casual employee, although the health facilities that I work in would say she hardly picks up anything anymore, which is true. I've been really bad. I got to start picking up and help them out this summer. But I am a tax-paying citizen. I'm a woman, and I am a single-parent healthcare worker. And I have health professionals in my family as well, and I've been personally affected by those changes in healthcare, as everybody has. I mean, as a woman and as a mom who's responsible for my family, I have to look at how I'm going to provide income, and when I see changes coming, I'm a smart girl. I look ahead and say, what can I do to protect myself and my family? Professor Hanson for us right now. And can you give us an understanding about where the story of healthcare began and how it got to the place that it was, avoiding political issues, but really talking true education and information? How did we get here?
Well, if you look, healthcare obviously goes back centuries, and And I think if you go back even 100 years ago, healthcare was largely driven by churches and not-for-profit organizations. It was considered a charity in many communities, and those that could afford to buy their healthcare obviously went out and did. And 40 years ago is when Canada adopted the Medicare system that we know today. And the part of the philosophy behind that, which was saying that no single family should be denied access to necessary care because they couldn't afford it. That we as a society had to take on that responsibility to make sure that everything that was medically possible to save a child's life or to make sure that they could live a healthy life, that everything was medically possible could be done. What's changing phenomenally is technology, because the boundaries of medical science are being pushed back so fast, and new technologies that, literally you can diagnose illness before it happens. Illnesses that used to be totally life-threatening a couple of years ago are now curable. But at huge expense. And we have new medications that there's one medication that I know of, it's a cancer medication for certain types of leukemia, $36,000 a year, not for a cure, just in order to help put that into remission. So now suddenly what is medically possible, we can't afford that as a society because it's getting so expensive. So we do have to reform healthcare, and we've got to look forward, anticipate those changes of 10, 20 years from now, and make sure that we position it so that we have a first-class healthcare system.
That is a huge challenge, and it's really, when you think about it, it's sort of it's interesting how that's set up that way. When you think about, we are saving lives more and more. People are living longer, and it's like the same sort of challenge that us as parents. In the simplicity of who I am, we have challenges with this great explosion of the internet, and now trying to control it with our kids. It's sort of almost the same idea. New technology brings wonderful advancements and hope for us, but it also brings major challenges in how we're going to wrestle with it, and how we're going to face it and deal with it. And I think that's probably where we're at. So then the average person would say, okay, what's happening right now are these are deep and fast and furious, and how is that going to help us in the future with what's going on right now? Are you able to expound on that right now?
Well, and earlier you used the term cuts in healthcare, and I must say I always recoil a little bit when I hear that term. Because we're talking about changes, but if you look at the size of the budget in BC, for example, it's increasing. It's increased by $2 billion over the last 3 years, and it'll increase about $1 billion over the next couple of coming years. So it is going up. But I think when you look at if to maintain the status quo in healthcare, we'd have to increase that budget by about 8% a year. So we have to find ways of doing things differently. And I think the other thing that's changed in healthcare in the past. Well, let me put it this way. Change in healthcare is easy if it's incremental change. But incremental change is hugely expensive, and we simply can't afford it. So now we're in an era, and it's not just BC, it's worldwide really in healthcare, where the changes in healthcare have to be the new and urgent needs in healthcare, the new priorities, have to be funded by identifying lesser priorities and reallocating monies within the system to the areas of higher and emerging priority. So it is a period of change, but some people will interpret change as cuts. I interpret it as just trying to modernize the system to deal with new and urgent priorities.
Yeah, and I would understand. And it's inevitable at some point that you're going to have those different perspectives. It depends on whose end you are on the receiving end. Whether or not you've been someone who has been laid off, that they would perceive it that way, or someone who's in your position where you have the responsibility to make those changes. But there are tremendous jobs and tremendous careers in healthcare, and and I think that I encourage a lot of young British Columbians to go into healthcare. Even like nursing, for example, we've increased the number of nursing seats at our universities and colleges by almost 2,000. And those are great jobs. And yes, nursing is a very good occupation.
And it is, and I think the shortage that we've had in the past has put a lot of stresses on nurses who are on the front lines today. But the more we can get new nurses educated and into the system, they're great jobs, and it will help relieve some of those stresses that we see today.
And I think we don't get, I don't think we get enough, all of us together, not you necessarily, but all of us don't give enough credit, I think, to our own citizens, because a lot of people, even those frontline workers that have been working in it have sort of seen the writing on the wall for quite a while. The nurses certainly have. I mean, I've worked in the healthcare system, and I listen to the nurses say, there's going to be a shortage, it's going to be a problem, and they saw it like way back. Because I remember I've been working probably 10 years now in the healthcare system, and I've been hearing that for a long time. So, and we know that it's not one particular person's problem, but it's sort of a big issue, that it's accumulated now. It's sort of hit the wall all at once. And I do want to also agree with you that nursing is a fabulous occupation, and the beauty about nurses is that they're very nurturing in themselves as people, and that makes the job that much harder, because they care so much about their patients that it makes it that much harder for them to throw themselves into their job and then face what it is that they have to face with the challenges in healthcare that they have to deal with. So
but
it's really
too often, I think we have tried to deal with those challenges without planning. And I'll tell you a story. When I was first sworn in as health minister in June of 2001, it was about a couple of days later I had this sort of the first structured formal briefing meeting with the deputy minister, who at the time was Leah Hollins. And I remember her telling me about the instructions she had from the Premier's office to create this new Ministry of Health Planning. And the instruction was to take all of the employees in the Ministry of Health who were dedicated to planning and move them over to become the backbone of this new ministry. And she paused and she looked at me across the table and she said, "I have to tell you something. We don't have a single full-time individual dedicated to planning." Wow. In a ministry with a budget at that point of $9.3 billion. And I think we're trying to catch up. It's not about sort of just getting through the next 6 months. It's about planning ahead for 5 years from now, and 10 years from now, and 20 years from now.
I think that's the tough thing that people are facing right now, is that, it's that 5-year, 10-year, 20-year understanding that we have to put something in place.
Well, people don't like the uncertainty either. When
it is scary.
In communities where we recognize we've got an old seniors facility that is starting to fall apart, and we say, yes, that's going to be closed and there's going to be a new one built. Well, where is it going to be built? And what about my mother who's in there now, and what's going to happen? Well, that's okay. That will all come out as we get through a planning process. Well, I want to know now. And it's understandable that people have that anxiety.
And it is, because they love their family members, and of course, and when they see, elders don't take change very well. In general, they don't, and they love their grandma and grandpas, and it just breaks their heart to have to see them face those kind of changes, because of that thing. So it's understandable that their reactions would be that way. I guess that's the tough balance, is balancing out what has to be done from a dramatic sort of place, and then how it trickles down into the everyday person that lives every day, and how they feel that impacting on their life. It's a challenge. It's a challenge that I sure am glad I don't have to deal with. And so just on that note, I'm going to just take a break right now, and we're speaking with the Health Minister, Colin Hanson, here on Unlocking Secrets for Women, and we'll be right back. We're back, and this is Candace Newton, host of Unlocking Secrets for Women here on CFUN. We're here in studio with the Honorable Colin Hanson, Minister of Health Services for the province of British Columbia. We've just been discussing how we got to this situation in population in our particular challenge in healthcare. And I think all of us really do understand, if we're keeping people alive longer, it's going to be a challenge to our healthcare system. Not to oversimplify the problems, but looking at it from a bigger picture point of view, there's got to be a reasonable explanation, and that makes sense. One of the things that I wanted to mention is that we need to have some good news in healthcare. We really need it now, probably more than ever. We need to have the good news. And, I respect that you understand the difficulty between, what happens in the legislature and decisions that are having to be made, and how they trickle down to affect the little person like myself and the other healthcare workers that are affected by these great decisions that are made. We sort of vision it like a big pencil that's sort of chopping up our lives. And it feels that way. It's a little bit too simplistic to believe that's just all there is. But we need some encouragement. And then you've talked about having to look at things from a long-term perspective, which really every single household in the province or country does does that when they sit down and they adjust their budgets. Every household does corporate review. I know when I got a divorce, my life changed very dramatically, and I said to my children, okay, corporate review is coming. There's things we can do and things we cannot do anymore, and now I'm going to have to look differently at how I'm going to plan my future for you. So that's very practical, and I think we can all understand the realities of that on a day-to-day basis. And if we can just take that and put that sort of into the mindset of how government has to make their decisions as well, it's a bigger scale, more dollars, but that's the reality of it. And we are a smaller country than the United States. We don't have the population dollar tax contributions in this country like they do in the United States, so things are a little bit different. But as far as good news, let's talk about the future and some good news that we can have in healthcare. One of the things that I love about our province, and ladies, if you're listening, we have free screening mammography here. We need to use those services that are given to us and make the best of them. And I think Dr. Karen Gelman was here and saying that we don't maximize the use of that screening mammography. So can you tell us what's positive in healthcare?
Well, certainly the screening mammography is one of them. And if you start looking at the number of women who do get regular mammograms is higher than any other province in Canada, and I think it's partly because of the way we've structured that program in this province. So that's the good news is that more women are getting it, getting mammograms, and the other good news is that we have some of the best, we have the highest survival rate of breast cancer of any province in Canada. And I think the downside of it is that there's still women who are not getting regular mammograms. So we can't rest on our laurels. And there are groups. I think the BC breast cancer or the Canadian Breast Cancer Foundation, a lot of great work they do in this province, and the Canadian Cancer Society, which also has some good programs, and BC Cancer Foundation. Yes. They all do some great work around with breast cancer in terms of research and support and screening. I think that's the reason why we're starting to see some of these beneficial results.
Yeah, we really do have some phenomenal people in this province, and there are some, I mean, the tragedy is that we have to have all these things because the disease exists in itself. That's the really hard part. But if we're going to, the reality is it's here. And then to have such a great support system for women here and to continue to move forward in that. Are you able or aware of anything that's moving forward in women's health care that we can be excited about and look towards? Are there further advances, looking at further procedures, looking at things that are new coming up that the healthcare industry is considering?
Well, I think if you look at some of the research that's being done in BC, whether it's being driven out of Women's Hospital or whether it's being driven out of the Cancer Agency, for example, it is world class. We have some of the best scientists in the world working right here in this province. And I think we're starting to show the results of it. BC Cancer Agency is celebrated around North America as the example for how to run programs to measure outcomes in ways that helps the whole healthcare sector understand why they're getting better results and to capitalize on that. So there's some great work being done in this province by our professionals.
Wow, that's excellent. And it might be just great to for those people that are struggling to know that you do care, Mr. Hansen, that you care about what's happening to them, their personal lives and how it's affected their personal lives, and these changes, these challenges to the growth, that you do care about the things that are affecting them. And
we often, if we go through some of these policy discussions and we'll often come back and sort of say, okay, now how is this going to affect Fred and Mary? And Fred and Mary is almost this fictional couple. And it's sort of that reminder that it's not about the stakeholder groups, and in healthcare there are so many groups that are advocates and putting pressure on the system. In fact, I heard a comment one time by a speaker that sort of rung a chord with me, and he said that healthcare in Canada is suffering from stakeholder through the heart.
Wow.
And I thought it was it summed it up quite nicely, because we have to be able to look at every issue from the perspective of the patient. And we also have to look at healthcare from the perspective of the individual in terms of how to keep them from becoming a patient in terms of prevention and those kind of programs. And we really, it's often that in the middle of meetings we will sort of come back to that touchstone of, let's not look at it through the eyes of the politicians or through the eyes of any particular stakeholder group, but let's look at this through the eyes of the patient.
Yeah, and the person that's going to be directly affected by those changes and the people that are affected by those changes, it is a tough challenge. I certainly wouldn't want it in front of me. But I know I have a cute little story. One of my classes I had, bless their hearts, a husband and wife team that were in housekeeping that had, were, let's see, how did you terminology, that were affected by the challenges in healthcare. They were in my classroom as I was re-educating them into another field. And they're, I said to them, well, what did you do when you were in your job? And they were telling me, well, we did housekeeping, and, and they were describing how they love to polish things and clean things. And I just said, have you guys ever considered starting your own business? And of course, I'm like, no. I was like, why not? Why not? You guys, I would rather hire you to clean my house than anybody, or clean a building, because you have such a passion for what it is that you're doing, and to try to bring hope back in the form of jobs. So when we're talking about jobs in healthcare, I've looked on the websites for professionals. There is a whole lot of jobs that are not filled. So it is very important for people to look at healthcare as a field and a facility that they can have a career in, because there is a career. Many jobs that are open. I'm very surprised by the amount of nursing jobs, technician jobs that are available in healthcare. It's quite interesting when you look at each of the individual healthcare websites that they have their job postings up, and there's quite a few out there, and it is a challenge. We're going to just be back right in a minute here and continue our discussion with the Honorable Minister Colin Hanson, Minister of Health Services here, and that's on Unlocking Secrets for Women. We'll be right back. Hi, we're back. This is Candace Newton here on Unlocking Secrets for Women on CFUN, and we're talking with Colin Hanson, Minister of Health Services for the province of British Columbia. We've been discussing healthcare, trying to get a better picture of how we got into this situation that we're in the first place. No one person is to blame for that. It's a bigger picture understanding. We understand corporate review. We understand that sometimes it's very painful. We understand that we've got a huge challenge ahead of us as far as looking at long-term sustainability in healthcare, and that's a big challenge to yourself and your position right at this moment. But I just want to touch on a couple of areas, and one is seniors in pharmacare and women in pharmacare. If you'd like to address that, Mr. Hanson, see if there's something that you can sort of open the eyes of the general public and maybe help them understand something.
Yeah. The pharmacare is actually the fastest growing part of our budget. It goes up by about 14% a year.
Wow.
It's new medications, and as we get older, we consume more medications. And the system that was in place before meant that seniors would pay, well, not more than $275 a year, regardless as to what their income was.
Mm-hmm.
And then you wound up with non-senior families. In fact, there's one case I remember of a single mom who had a daughter that was diabetic, and huge pharmacy costs every year. And yet what that mother was facing was she would have to pay the first $800 out of pocket, every penny of the prescription, starting January 1st of each year. And then financial assistance under pharmacare would only click in at once she'd spent $800, and even then it would only max out when she'd hit $2,000 a year out of pocket. So we restructured the system so that those with lower incomes would get more financial assistance, and those with higher incomes would wind up paying more. And 82% of BC families either paid less or the same as they had under the old system. But it did result in a system that was much more fair. So we were able to reduce the amount that the individual would have to pay for low and middle income seniors. And yes, those seniors with higher incomes wound up paying more. But we haven't had a lot of complaint from it. I think there's some people who perhaps have higher incomes that think that there is an entitlement, that because they paid their taxes all their life, that somehow things should all be free once they've retired. And we simply, as a society, couldn't afford to do that. But women do consume more medications than men, senior women in particular. And
Is that because of the challenges with osteoporosis and other diseases that go along with aging?
I think it is just it's no one particular cause, but it's just that there are great medications that have been developed that can now save lives and allow people to live more independently and more illness-free in their older years. And we have to find ways to support those with lower incomes. And I think we've been able to do that through the pharmacare changes.
That would, all of us have senior, parents, aging grandparents. I know certainly we do in our personal family that are taking, large amounts of medication, and it is allowing them to live their life and being able to have a better quality of life. So it would make sense. I mean, that's the challenge when we're keeping people alive longer.
Yeah.
That's the challenge. We've got to find a way to be able to afford that.
But the medications are not a substitute for healthy living too.
No,
and
no.
and I think it's also so important that that everybody stay active. And I always put out a 3% challenge. We talk about putting aside a certain percentage of our income so that we can have an income when we retire.
Mm-hmm.
But we should also be putting aside a certain percentage of our day
Mm-hmm.
to make sure that we stay active and stay healthy. And because if we do, we'll be able to enjoy those retirement years.
Prevention is huge. Prevention's very, very big. I just heard when we're talking about health and staying healthy, I just heard this sort of a little bit off topic, but I heard that the statistics now for obesity outweigh those for malnutrition. Just scared the daylights out of me.
It is.
And it's really like, okay, we need to do something seriously now. We have to find a way to incorporate health care, physical education seriously and continue to encourage that with our children and our young people and sort of deal with these issues that we have to face now, which, will in the long term cause more problems in our health care if we don't fix ourselves and become preventative. And preventative care programs are extremely important.
It's very, very true.
Yeah, it's very true. I like your principle of the 3% thing. That's very. Now, can we talk about seniors and housing and those issues as far as where we're going to place? I mean, I'm looking at going, where am I going in the next, I'd say 100 years, but that'd be a lie. Where am I going in the next, 20, 30, 40 years? Okay, 40 years. Where would I'm going to end up for my place to live, and how is that going to be? Is it going to exist for me?
Well, one of the things that we did before the election, when we were still in opposition, Gordon Campbell led a series of dialogues on healthcare around the province, 26 different communities. We invited citizens and community groups to make presentations. One of the themes that we heard over and over again was that seniors wanted to have their independence. So it's that big fear between going from the family home into the nursing home and that total loss of independence that go along with that. And many seniors, particularly senior women, raised those issues and said that there's got to be, don't lock me up in the nursing home kind of thing. And what we're developing right now, I think, is really quite exciting, and it's the whole concept of assisted living that says that there is safe housing, independent housing, apartment-like, home-like settings, but having the supports available, with a call button, or they can have the help that they need on the days that they need more help. More help is there, but they get their meals provided, they get socialization, activities,
and they still have their independence.
But they still have their independence. And I've talked to a couple of seniors that have gone into these facilities, and they are just they love them. So
yeah.
We will see a lot more of that. It is a new concept. It's giving seniors more options, but what I think we're finding is that it's common sense, is that seniors can live independently providing they've got the support available to them. So in the next couple of years, you will see more and more emphasis on home support and independent living models. And I think that seniors, particularly senior women that I've talked to, love those kind of options.
Well, I know, we all, as I said, we all have seniors in our family, and it's very vital for them to maintain their independence. And that's important to them, that they do have those supports that allows them to have the best quality of life they can have. As you said, what's the point of helping them if we're not going to give them a good quality of life? And on top of that, what are the challenges that you see currently right now in dealing with that issue of trying to create the housing and the assisted living? Do you have challenges in front of you right now?
Well, there is. Certainly there are some that are saying that assisted living isn't adequate. I urge those people to go and actually explore what it is. And there's stuff online. There's certainly a couple of these facilities have now already been completed and opened to look at and see how the model works. The other big challenge is it's just you can't do it overnight. And we will be cranking out a significant number of new assisted living beds in the province. We've got sort of one block that's coming through Independent Living BC, which is where the not-for-profit sector will actually produce 3,500 of these new units. And they're funded on a income-tested basis, so that lower-income seniors get much more financial support to stay in these facilities. So even that they get their meals provided, they get their housing, they get their personal care, and the maximum that they would pay for that is 70% of their income. So they would still have 30% left over for the incidentals, like it may be cable vision, or it may be Christmas presents for grandchildren. But,
or 3 weeks in Arizona, no.
well, that's possible too.
That is possible too. We're going to be right back in just a minute, and we're here with Colin Hanson to continue our discussion on healthcare and what's positive for the future in healthcare in British Columbia. That's here on Unlocking Secrets. We'll be right back.
Now, back to Unlocking Secrets for Women on CFON 1410 AM.
We're back, and this is Candace Newton here in the studio with Colin Hanson, Minister of Health Services for the province of British Columbia. We've been talking about, the big challenges in healthcare and understanding the bigger picture, how we came to be, trying to talk about some of the positive things, healthcare for women, pharmacare and the changes in pharmacare that are hopefully bringing about positive changes. Mr. Hanson, I have a funny way of looking at things. I sort of look at, I don't like being controlled. I've just got this big issue where I like to feel as independent as I can. And with all due respect, government changes sometimes every 4 years in an election. And I hate to be victimized by something that's going to change every 4 years. It feels like an abusive ex-husband sometimes. He's going to withhold money, give money, take it, give it. And so I sort of look at life from a bigger picture point of view and say, forget all these kinds of uncertainties. And I rather position myself as an individual, as an intelligent person in this province, woman, single parent, an intelligent individual, that I want to position myself in a way that is more solid for my own future. And so as a citizen of this province, what can I do myself? Because I want to feel empowered. I don't want to feel victimized by what I think are the whims of government that changes every few years. And, sort of have this sort of mean ex-husband or something, that's sort of telling me what I can and cannot do. I want some power back as an individual. What can I, as a taxpayer and an individual, do? A healthcare worker, what can I do that's going to say, I feel like I've got some of my power back, that I'm not being victimized?
Well, I think the most important thing is to stay healthy and learn about preventative health care, good nutrition, exercise. The best thing that any single person can do is keep themselves out of the healthcare system by taking good care of themselves. And I think we have a healthcare system that I think does a great job of providing illness care after people already get diseases. What we don't do a good job of is helping people to stay healthy in the first place. And we have to put more emphasis on that preventative side of it.
Have we done that? Have you implemented those things that are preventative?
There are a lot of initiatives that are underway, and but clearly a lot more than we can do. One of them is as basic as immunizations that will help prevent the onset of disease and illness among our children. And I think those have made huge strides, and we've expanded actually the immunization programs a lot in these last 2.5 years. We have more to go actually in that regard. But there's programs like Action Schools, which is encouraging more activity in the schools, not in a way that's sort of around the jocks and those that want to get into football and hockey, but just around activities that 100% of our kids can get involved with. But most importantly, we have to set an example. And for example, I took up running 3 years ago. I love running, which I only discovered 3 years ago. And it's had a real impact on my own kids, that I've noticed that since I've started running, they've actually started being more physically active too, and getting down to the gym and staying active. So
it's true. My daughter and I are fighting over the treadmill in my room. It's like, okay, but it is true, because when you think about, I'm assuming you're close to my age, somewhere in there. I don't mind telling how old I am, but unusual for a woman. But in my day, we didn't have the lifestyle set up that we do now. Our lifestyle is very different now, and it's definitely more sedentary. We're on computers all the time. Children are socializing around their computers. That is essentially what's happening all the time. So we don't have the lifestyle set up for that physical activity. And it's interesting how we're having to go back to the days that in the way that we were raised to start bringing back health back into our lives again in activity. Unless you have some kind of constitution like George Burns, where you can smoke cigars till the cows come home and drink that shot every day and live till you're 100. I don't know how those guys did it.
Actually, an interesting question that comes up out of that is, we're both baby boomers, and The fastest, a lot of people, when you ask what's the fastest growing age group in British Columbia, a lot of people will say the baby boomers, right? Actually, the fastest growing age group in BC are those over the age of 90.
Wow.
And
It's true.
it will grow, the number over the age of 90 will grow by 40% in the next 3.5 years.
Oh my. And they are a bright group. These are a intelligent group of people because they're educated, they're stimulating their minds, they're keeping themselves aware of what's going on around them. That's going to be an interesting challenge to face that. Yeah, you wonder how the Bob Hopes and the George Burns and all the rest of them lived their life, and they did everything what we think is wrong, but they did it right, and they're still existing. And well, they not now, but they did. They lived a long, sustainable life. So then, other than obviously keeping ourselves healthy and participating in that, which is very important, and I agree with you, over those preventative changes. And I'm really looking forward to more and more things that we can hear coming out of health services that's going to encourage that, together with education and activities. What else can we do? Are there other things that we can do as citizens that will help us to sort of do our part to fix this, at least in our own province here? Because as I think I told you on the break, in BC, we have it's a beautiful province. People love to be here. And I think that it's a bigger challenge for us in some of certain provinces across the country when we have a population that loves to be here.
Yeah, but I think information is so empowering. And a couple of years back, the ministry sent out a health guide to every household in the province, and it's a great resource. And I find that people feel empowered by that because they can look up a particular condition, they can get information as to whether they should in fact go to a doctor or an emergency room, or whether this may be something that's not as serious. And that's actually online now too, on our website. The information on the web is huge. Like the Ministry of Health Services website has a lot of information about managing chronic conditions and health prevention. And the other thing that we have been expanding is the nurse line.
I love that. I absolutely love that nurse line. We work in Emerge. We love the nurse line because there's so many phone calls that we can field to the nurse line that takes off the emergency room pressure.
Yeah, the nurse line, it's 7 days a week, 24 hours a day, and it's a 1-800, I think it's 1-866, I should be careful here, 217-4700, I think. But it's, at the end of that line, any citizen of the province can get access to some health guidance, and it's averted unnecessary emergency room visits. It's averted unnecessary doctor visits. The other thing that they found was in the overnight hours, from the evening and overnight till 8 o'clock in the morning, a lot of their calls were related to medications and side effects from medications. So they have actually just extended it to include a pharmacist who can be available.
Excellent.
Like the nurses can refer to the pharmacist just with simply transferring the call over.
Wow.
And get that pharmacist advice during the wee hours of the morning. And that initiative actually has just won a national award for pharmacy innovation.
Well, I would think so, because it's just intelligent, just makes sense, common sense, to give people that access to information. I know that we have used the nurse line ourselves in our home with our kids, and it's fantastic. Who wants to drag their children out in the middle of the night if you don't have to, or to go into an emergency room and sit there and wait for hours and hours at a time? There's some people that are going to have to wait, but for those of, if we can avoid, using the emergency department really as a clinic, it makes it easier because we can then deal with the problems we need to, and to be able to access a pharmacist in the middle of the night to say, how much medicine can I give my baby right now, and this is how big he is, how old he is, and he's not feeling well, what can I give him? It is, and the health line is very good. They take their time with you. They don't rush you through anything, and we found these nurses are very great, very compassionate, and they spend a lot of time. In our particular situation with one of my daughters, they spent a good half hour on the phone, and then they were concerned. They said, please call us back if you have any other problems. They followed through with that, which was phenomenal, and then encouraged us to see the family doctor in the day. It's a very good program, and I think it's necessary because of how busy we are, that we need to get something back into the hands of people where we can call.
But I think all of these things are empowering for people too.
Absolutely,
because the days when healthcare was something where the doctor dealt with the technical side of what's wrong and sent you home.
Yeah.
It's got to be much more holistic than that.
And our doctors, bless their hearts, are busy. They're busy, busy, busy people, and they try their very, very very best to accommodate what they can. But, you know, as we get more and more educated and more access to knowledge, women in particular are, and not saying anything against men, but women who are the caregivers in their family, for the most part, are very, very, very proactive about finding information. I mean, you've got websites on the internet that are virtual hospital, you've got just about everything, and women are starting to educate themselves and going back to their physicians and saying, we want this done, or tell us about this. And so even the way that medical companies or even healthcare is marketed in the past is completely changing its face.
Yeah.
It's now going almost direct to the consumer. They're doing it. Those women are on the internet. They're searching out answers. They're coming to their doctors with information, and they're sort of taking that proactive, like you say, empowering stance of themselves towards their own health care and the health care of their families in general. And that does give people power. Information is power, and that's very important that I think we as citizens of a province and as a country begin to understand that we have a role to play as citizens in our own betterment of our own country and the betterment of our own province, finding things that we can do as citizens to improve. And to, you know, it's sort of funny, I have sort of this saying, I have people look at me and say, well, the government should be doing this, and then they get mad when the government has too much control, and I was like, kind of like a catch-22, you know. I think that we are intelligent people. I think we can sustain ourselves very, very well. I think we're creative, we're smart in this province in particular. I happen to be biased to BC, Victoria-born girl, makes me a little biased. But I think we can do much more to help ourselves in this province to become and to achieve our goals together, instead of looking at government as being antagonistic. Really and truthfully, government are our servants. They are there to serve us and to work together with us to achieve the same goals. And, you know, whether or not we believe that, if we become too cynical over the years, it is the truth. And to be able to embrace that concept and put that forward in our minds, I choose to look at things from that perspective. It doesn't mean that I'm naive. It doesn't believe that I don't see things that I particularly think are a challenge. It means that I've chosen to look at things from a different perspective, and that is to say, you know what, we can put hand in hand and arm and work on this together, because it's our problem. We elect people in, and we've asked them to serve us, and now we need to work together with them on those solutions. And that's my personal philosophy, and I hold to that, try to teach that in my classrooms. Well, Mr. Hansen, I appreciate you taking the time to come in today, particularly on this particular day. It was not planned that you would be here today. Actually, it was planned that you'd be here today, but it was sort of not this particular day. We had no idea that this would be the day, and I appreciate that as an HEU member that you didn't shy away from having me talk to you. And I appreciate you coming in and taking time off your day off. I don't think you get much time off, especially with the budget that you have. So I'm particularly grateful that you came in to speak with us.
Oh, thanks very much. I must say I do enjoy the job, and it's because there's lots of challenges out there, and the job never gets the least bit boring, I'll tell you.
I was going to ask you, you must have some kind of something going on in you to want to take on such a bulldog challenge in front of you, because that's, I don't know, do you sleep well?
I do.
Good for you.
Mind you, I find if I don't get out for a good long run every now and again, I went out for a 15K run this morning.
Oh, you
and
did?
That's a good stress reliever.
Holy, I just feel like